The first couple being diagnosed with COVID-19 by talking with a medical doctor. Many of us may have questions about the diagnosis, the president himself, and also contact tracing. Joining us now is Dr. Aaron Shoemaker, the Chief Medical Officer with Ascension Medical Group, to try to help us with understanding exactly what is going on. Good morning to you, Doctor.
Good morning.
Now, we obviously don't have his direct medical, assumption from the doctors there, but we do know that he's a male, and generally that's a strike against you. He's in his 70s and his BMI is rather high. Do you see having any of those having a big effect or not?
Well, certainly all those put him at a higher risk category. The reality is that even at all age groups, when we test positive, we very well may be asymptomatic or have very minimal symptoms. So it really just depends on the symptom progression. Once you develop moderate to severe symptoms, that's when your risks really escalate in those groups.
So we know there's obviously no vaccine. In reality, there's no treatment right now. There are things to lessen the amount of time you stay in the hospital, like remdesivir, et cetera, et cetera. Do you see them putting them on any kind of a regimen?
That's a very good question. The formal answer is there is no certified treatment for COVID prior to hospitalization. Once you're in the hospital, if you have that moderate to severe case, then there is evidence for remdesivir, plasma, and steroids. But outside the hospital, it's really a clinical decision by the physician who's treating the president.
What sort of signs would you be looking for, besides from the actual testing, that if he's showing anything that would prove that he has COVID, maybe in a bad way, that it's getting very, negative, I guess you would say?
Yeah, fever and cough would be the first two significant symptoms that you would start to have some worry about. And then the cough can progress to shortness of breath. And certainly when people start to get some feeling of respiratory distress or shortness of breath, not catching their breath, that's when your concern level is going to go up more significantly, and you would generally consider treatment if they meet hospitalization criteria.
Now, we just heard about a tweet that Angela read from Ivanka, and we know that Jared Kushner was on the flight with Hope Hicks along with the president. Are those contact tracing situations you would do? Would you tell that person to quarantine as well because of the proximity from one person to the other? But what about from one person? You see what I'm saying? A to B, B to C?
Yes. Yeah, so the guidance would generally be once you have symptoms or are under suspicion, you would isolate for 10 days and after positivity, and then anybody within 6 feet for 15 minutes would actually be in quarantine for 14 days. And so that's the general guidance. So they actually have to go and look who is within 6 feet of the president for 15 minutes.
All right, Dr. Aaron Shoemaker, thanks for being here this morning. A lot of good advice. We do appreciate it.
Thank you.
All right.